Kostelnik with Rooted Behavioral Education. I'm a clinical health psychologist and fellow vestibular patient. And today we're going to talk about a very important topic which might apply to many of you, and that is cervicogenic dizziness. So I'm going to turn it over to Dr. Drew for an introduction and to tell us a little bit more about what cervicogenic dizziness is.
What's going on, everyone? I'm Dr. Drew. Super excited to talk about this. Dr. Kostelnik and me met through Instagram, following her work, and she does a lot of awesome stuff. What I do is work with a lot of people with neck pain and often cervicogenic dizziness. And as you know, if you've gone through this, just going through that experience of having neck pain, being dizzy, comes with a lot of mental health components as well. That's why I was super excited to talk to someone who does this as their specialty, is an expert in helping people with vestibular issues and the mental health component that goes alongside of that.
So maybe Dr. Drew can tell us, what is cervicogenic dizziness?
Yeah, so cervicogenic dizziness is kind of a catch-all term for dizziness that's caused by your neck. It can actually be like a lot more kinds of cervicogenic dizziness than even I realized when I graduated school. Like if you do some research on it, they would consider cervicogenic dizziness when some blood vessel in your neck is occluded and is causing dizziness. Sometimes that could even fall into that category. But really what we're talking about today, and what is more common, what is treatable by physical therapy, is a disruption in the function of your neck that causes dizziness. So if you think about what's your neck supposed to do, what's its normal function? Well, obviously it helps support your head, it turns your head, it tells your brain where your head is in space, alongside your vision and your vestibular system, communicates that information to your brain, which mixes all that together with your vision and your inner ear to give you that final output of, hey, I'm in the right spot. If you have an injury to your neck, whiplash, or even if you just have neck pain for a long time, or you're putting your neck in a weird posture for a long time, that can change the function of your neck. It's not in the position your brain expects. It's not reporting movement the way your brain expects. Really, there's a disruption in the normal function of your neck, that function of letting your brain know where your head is in space, that communication with your vision and your vestibular system. And that mismatch, that misinformation that your neck is sending leads to dizziness because you're not sure where you are in space. The dizziness isn't like a room spinning vertigo dizziness. It's really more of just kind of a lightheaded, out of body experience. So like I said, and I've gone through some cervicogenic issues as well after having whiplash, it can cause a lot of anxiety, fear, and other kind of mental health concerns. That's why I was so excited to hear what Dr. Kostelnik had to say about kind of what is the role of mental health when you're dealing with cervicogenic dizziness.
Sure. So there's multiple factors at play here. We have the neck pain, the dizziness, and then how that impacts our functioning. And while all these things are related, let's first talk about the pain. So there's something called the gate control theory, which basically says the way we experience pain is influenced by our emotional state. Meaning if we're catastrophizing pain, we're constantly worried about it, we're restricting movement, we're actually going to experience that pain as more severe. And severe chronic pain leads to a vicious cycle of anxiety and depression. Dizziness can be similar. We know that dizziness and anxiety both cause sympathetic arousal, which can also cause a vicious cycle. So we can help break the pain and the dizziness cycle by treating underlying mental health issues. So, Dr. Drew, how is cervicogenic dizziness treated from a PT perspective?
That's a great question, and it really gets back to what we talked about in the last question of what cervicogenic dizziness is, what causes it. So we talked about that it's really a mismatch of how your neck is functioning in terms of its position and movement to what your brain is expecting or what the normal was before the injury or prolonged period of bad posture. What we want to do is fix all the factors that are leading to your neck being in a funky position or moving a funky way, or if it's from whiplash, then work on strengthening the tissues and restoring normal function of your neck. Also doing some more specific exercises to help make sure that your neck and your brain are communicating well. It sounds funny, but it's kind of like, how do you know when your eyes are closed that you're turning your head to the left or the right? You can feel, your brain can sense the motion that your neck is reporting. So you do some specific kind of exercises to make sure that that pathway is functioning properly, and also communicating with all your other systems of balance, like your vestibular system, your eyes. And then what I've always wondered is, what's the best way to help people deal with the mental side of recovering from something like this?
Sure, so we'd really want to tackle those catastrophic thoughts and avoidance of certain behavior and movement using cognitive restructuring from cognitive behavioral therapy and mindfulness techniques. And then especially important for the dizziness piece is to learn some techniques to calm that sympathetic arousal. So I know that we agree that lifestyle habits can be really important. So I'm going to turn it over to you, Dr. Drew, to talk about some lifestyle habits that you might incorporate with your PT patients.
Yeah, I think that was one of the things that stood out when we first met and we're talking to each other is we've both gone through stuff like this. We've both helped quite a few people go through stuff like this. And it really comes down to, can we create some positive habits that are going to lead to the change we want? When you're dealing with neck pain, dizziness, all the other things that go along with it, you need to find something that works, that can give you a little bit of symptom relief, that isn't too overwhelming to do, that doesn't make the symptoms worse. And from what I understand, and we'll talk about that, but that's similar from the mental health point where you just got to start to find some good habits. So for someone who's busy, stressed out, symptomatic, lots of dizziness and pain, they're probably not going to want to do an hour-long exercise program that makes the pain and dizziness worse. It's way more beneficial for them to start out with a 10-minute routine that's specifically planned for them that they can get through every day without too much problems.
So I can really echo what you're saying here. Small habits are very important. And one thing I like to talk about with my patients is something called SMART goals. So the S stands for specific, M is measurable, A attainable, R realistic, and T is time limited. And because of that downstream effect I mentioned of mental health on pain and dizziness, we really want to target all the lifestyle habits known to influence mental health. This includes sleep, exercise, diet, hydration, mindfulness, or relaxation practice. So I hope this was really helpful for you all today. We're happy to answer any questions. If you want to find me, I'm at Rooted Behavioral Education on Instagram or Facebook, rootedbehavioraleducation.com. Dr. Drew, maybe you can tell us where we can find you.
Yeah, thanks for tuning in. This affects a lot of people. I was really excited to put this together because I think getting that kind of comprehensive information about how you can treat it is difficult to find, and hopefully it will be really helpful. So on Instagram, I'm just dr.drew.aligns. Reach out with any questions, DMs. And yeah, we both love talking about this stuff. We're both nerds about this stuff, so be happy to answer your question. Cool, yeah, and if you're dealing with this stuff, check out Dr. Kostelnik's program. It sounds awesome. She's explaining it to me. It's really got everything I think you would need from the mental health standpoint. It's called Breaking the Anxious Dizzy Cycle, which is unfortunately kind of where a lot of us get stuck. And I know when I was dealing with that, I was stuck there for a while too. So yeah, it sounds like a really cool program.